21 minutes after the hour of 7 o'clock. Welcome to the Now Morning Show here on TTT. Of course, the coronavirus has us all in a spin, and it's why we're here discussing whether we support this idea of a carnival in a pod and who are the people who are benefiting while others are left outside. So, no surprise, we're talking about the coronavirus pandemic this morning, but long COVID, what does it really mean? What are the symptoms? And where you can go to get help. So let's welcome to the program this morning Dr. Ravi Lalla, Medical Chief of Staff of the NCRHA. Good morning to you, Dr. Lalla.
Morning. Thanks for having me.
Thank you for being with us. Happy New Year, man. It's still not too late.
Yeah, Happy New Year.
Thank you. So, Doc, I am sure I've spoken to you about this before. It's been a while. I don't know if you remember, but we have spoken about the clinic in Arima. But let's just start with, COVID-19 and this idea of long COVID. What is long COVID?
Right, yeah. So the WHO does have a kind of involved description of what long COVID is, but basically it's 3 pillars. So you must have had COVID before. And your symptoms must begin 3 months within having COVID, and it must continue for about 2 months and basically not be explainable by any other disease.
Okay, that's interesting. So I have to wait at least 3 months to look for any symptoms. And are these symptoms would be symptoms that I would have had while I had the virus, or different symptoms?
Basically anything new that you didn't have before. So for instance, if 3 months after you had the virus, you now have increasing shortness of breath when you try to exercise, that's something new. Or there's so many symptoms of long COVID. It runs the gamut from shortness of breath to changes in taste and smell, having difficulty sleeping. It's a lot.
Wow. And I remember speaking to a virologist who is Trinbagonian but living on the outside, and we were talking about the neurological issues that can happen as a result of long COVID. Could you just talk to us about that? Because I think some people just think of the shortness of breath and forget that there are other things that can happen as a result of long COVID.
Yeah. So for people who have had mild COVID, even people who have had mild COVID, you could then go on to have a long COVID syndrome. And one of those, including shortness of breath and like malaise and easy fatigue, would be what the WHO terms as brain fog, which is basically difficulty concentrating and remembering what tasks you were doing and stuff at a particular time. Mm-hmm. So that's mainly what they mean. People who have severe COVID, of course, are prone to strokes.
Really?
And more severe, yeah.
What are the most or more debilitating symptoms of long COVID?
Right. Well, for people who have had severe COVID, the most debilitating symptoms would be, well, you have the lung symptoms. So people who have severe lung damage after COVID, and that would affect your life in any number of ways. Just the ability to be able to do any of your regular tasks of daily living. And as well, people could get strokes, people could get clots in the lung, people could be prone to kidney damage. And then you have all of these difficult to classify inflammatory conditions.
Yeah.
So it's a wide gamut.
Yeah, well, obviously, I hope people are really taking notes so that they can start checking themselves to see, okay, if I had COVID, am I anywhere along the spectrum? But in terms of long COVID, you said that you must have these symptoms for at least 2 months. But can it go on beyond the 2 months?
Of course. Because COVID is an emerging disease, one of the things is that we're not really sure how long something could go on for. But definitely there are people who are suffering with long-standing lung damage and stuff. And the pandemic is now 2 years plus. And
I know,
some of those people still have those issues.
And what can we say for Trinidad and Tobago? Can we say, how many people, what percentage of those who've contracted COVID are suffering from long COVID?
That would be difficult to say. And the reason is our clinic in Arima, our executive wellness clinic, we've been seeing the patients who were more critically ill. So it's difficult for us to put a figure on that. I know
Right.
internationally sometimes they say 1 in 10 patients would have effects of long COVID.
Well, that's significant. One in
Mhm.
10 is definitely significant. So, Doc, talk to us about the clinic because I know that the clinic is there. What does the clinic do? How does it help those who have contracted COVID-19 and have survived?
Right. So as I was saying before, we put the patients who are the sickest patients that we've had, patients who went to ICU or who almost went to ICU. We put those patients into our clinic. And basically what our clinic is what we term a one-stop solution shop. So how a typical clinic would run, you would go to see a cardiologist, you would go to see a lung specialist, you would go to see a kidney specialist. But we realized because COVID is such a multi-system disorder that having people come repeatedly to see different specialists wouldn't really be wouldn't be patient-centric. And so our clinic has all of these specialists come together at one, and a patient cycles through our clinic. Not only that, we didn't want patients to have to see a specialist and need a test and then have to go to get the test and come back. So what we did is we conceptualized the clinic that works in cycles. And so there's a circuits, and there's a morning circuit and an evening circuit. And in our morning circuit, you get all the investigations and the results so that when you see the specialist in the afternoon, they have all that information. So you will get x-rays, CTs, get the results, echoes, get the results, blood tests, get the results. And when you see all the specialists in the evening, when they make their plan for you, which will include pharmaceuticals, that then goes to a clinical pharmacist who then reconciles that list to make sure that we don't have any unwanted drug-drug interactions. And if we see something, then the entire team will huddle around that particular patient and come up with what would be the best solution.
Doc, I think what you're explaining to me is what every single solitary Trinbagonian would like to see right across the length and breadth of the healthcare system, where we have that kind of what people like to call this holistic approach to healthcare. So, are we going to be seeing this idea of this clinic and this mirroring of this clinic somewhere down the road? Do you know?
Well, definitely in other facilities, we're looking to start other COVID clinics. And the idea definitely is transportable. So yeah, I suspect that is something that we could be looking towards. As in anything, there's an opportunity cost. So just that people would understand, for every patient that comes to our clinic, we actually chart that patient's progress before they come through the clinic, like where they will go from, which doctor, which test. So
Yeah.
it's a dance we do for every patient to ensure that no patient ends up going through a process that takes from 7 in the morning till 7 in the night. To make it work efficiently is very labor intensive.
Right. I wouldn't doubt that it's labor intensive, but I think, especially with COVID, that these patients would definitely benefit from all of these doctors and services coming together because it sounds like healthcare at its best from what you're telling me.
It works really well.
So, Doc, in terms of, when you see that patient, just walk us through the process. How do you determine what patient qualifies for the clinic, or do they just walk in and say, okay, well, Doc, I had COVID and I'm still feeling this, 2, 3 months down the road? How does it work?
So usually we would get a referral from one of the physicians who would have seen the patient. We have a website, execwellness.agh at ncrha.co.tt. That's exec wellness, execwellness.agh at ncrha.co.tt. And so the physicians who see the patient would refer to us. We have a form which is scattered throughout the RHA that available to all the doctors. And And so once they email to us, we then reach out to the patients. The reason is, as I said, we're really targeting in this phase all the more critically ill patients. And so once they send the form, either via email or a patient could actually take the form and bring it to our main lobby, and it would find its way to the clinic. We have a process for that, and we reach out and we book the patient in.
Right. And how long do you all evaluate or monitor these patients?
It depends. So if somebody has ongoing complications, because we have patients in our clinic that are still there from the inception, and we have some patients who's, because of management and whatnot, they actually were able to be discharged from the clinic. So it is a gamut, again, like everything in COVID.
Right. All right. So, Doc, so you have all of these patients. Well, how many patients have we? When did this clinic start, by the way? You said
Yeah. So
was it last year?
started in October 2020.
October 2020.
Yeah.
So
When
we've
we
had quite
started
a
this
few
clinic,
patients coming
sorry.
through the clinic thus far.
Yeah, so we've had 183 new visits with 343 revisits. So over 500 visits in total to the clinic. And every time a patient comes in, even if you're a revisit, you will have a battery test. You will have to still join the circuit because you would have come back for some continued monitoring and evaluation.
Outside of the referral system, if a patient is outside, listen, and figure that, listen, I might be having some kind of, symptoms of long COVID, can they walk into the to the clinic?
It wouldn't be possible for them to walk into the clinic because the way how the clinic is set up, in order for us to accommodate that person, we really have to know that they're coming and set up a structure specific to that individual.
So how do you catch those people? How do you cater for those people who may not have that referral letter, who may not have been caught by that particular doctor who treated him or her?
Yeah, so they could go to any one of their health facilities in the area, and they just tell the physicians there that they consider joining our executive wellness clinic, and they should have the forms to be able to refer to us. And
Is
we'll
there a
reach out.
cost attached to it, Doc? Is there a cost attached to this
No
holistic
cost.
care?
No cost.
Wow, that's the most exciting part in this time for a lot of people, Doc. All right, Doc, we have about 30 seconds. Your final words before we go.
Yeah, so I just want to appeal to everyone that the best way to avoid coming to our clinic is to not get COVID. And so far, despite all the variants and everything we know, the best way to avoid getting COVID is to get vaccinated. We have a growing number of people in the country getting vaccinated more and more every day. And to those who haven't, come join us.
Before we go, Doc, have we seen any correlation between variants and long COVID?
I think what we're seeing is more correlation between severity of disease. So how the Delta variant seem to have more severe disease. More of those patients end up in our clinic.
Okay. All right, Dr. Lalla, thank you so much for sharing with us this morning.
All right, thanks for having me.